So good morning, everyone. Yes, I'm originally a psychologist by training, but my father had Alzheimer, right? And when I was like finishing my doctorate, which propelled me to get further training in nutritional medicine, which is why I combine my practice as a nutritional therapist and also psychologist, which will explain the topic of today's presentation, mainly to do with cognitive function. Oh, this is, okay, no, one page at a time. So I found a well lab in Malaysia, as well as the International Psychology Center some over 10 years ago, where we provide very advanced diagnostic tests to enable to measure and monitor and enable personalized medicine. Is there like a page down instead of? Well, that is me. All right, so today I'm going to talk about Klotho, who was discovered by Dr. Makoto Kuro, and by accident actually. And he named it Klotho after the Greek fates of goddess Klotho, which is spelled with a C, but he changed it to a K after his own name, right, of Kuro. So it has numerous functions, but what it is a simple protein that holds a lot of information. One of the pioneers in the studies of Klotho is Dina Dubai. In fact, by chance, there are two groups of scientists that come to make very important discovery, and they talk about it rather than being competitor. They publish it together very recently. One group in Australia, one is a Dina's group, and another in Europe as well. Right, so Dina's lab found that there are mice, right, that when they are treated with Klotho, they show very enhanced effect on their cognition. And this is the same for young mice, old mice, and diseased mice, right? They all show great improvement with peripheral Klotho treatment by injection in this case. And the other thing of note is it is the performance is of improvement is dose dependent, meaning you give higher dose, you get better performance, right? So you get this super mouse, in fact, with a very higher dose. So so that is the finding, and also for those with cognitive decline, the decline can be reversed as well. So the question then becomes, how does that work? Because Klotho does not cross the blood-brain barrier, right? So one of her research assistant, Dr. Pap, I believe this is the paper by her, found that in fact the Klotho stimulates release of blood platelets, right? Particularly one called platelet factor 4, which acts like a messenger to cross into the brain to improve all this cognitive function. And later, they found that even without Klotho treatment, by just injecting this platelet, blood platelet factor 4, it would lead to similar improvement in cognitive function. So this is the current idea then. The platelet-derived factors would be the mechanism that drive all this improvement and reversing neurodegenerative diseases. There's another group in Australia, Dr. Tara, that found that in fact when you exercise, it would also lead to increase of this platelet factor 4, and that also lead to a lot of cognitive improvement in the brain as well. So here they have mice that are diseased, the alpha-synuclein transgenic mice. So that means that they artificially induce Parkinson's disease or Alzheimer's disease in these mice, and they find there are reversal using this type of treatment as well of a peripheral elevation of Klotho to the platelet factor 4. And also there are also the resilience against the toxin of Alzheimer's from here. And this treatment, this effect are sustained, right? Rapid and sustained. So then the question is, can this be applied to humans, right? Because these are mice study. So all these mouse, disease mouse, perform much better in cognitive tests. So that's how they measure it after administration of alpha Klotho. And that they also have a Parkinson's mouse as well, showing the same effect. And the effect continue on even after 2 weeks, right, of ending the treatment. And there are also other experiments they've done without the Klotho. If they have the mouse fasting, it will also increase the Klotho level, leading to similar effect. So what is the mechanism? So the proposal is that there's NMDA receptor subunit called GluN2B, right, which enhance the synaptic plasticity, which is critical for memory and learning. And this alpha Klotho works by promoting this subunit. So hence, there's much excitement for human application in this research. Next, they also done the experiment on monkeys. And the difference is, with monkeys, the window of therapeutic dose is much more narrow. Right? With rats, with mice, it is dose dependent. The higher dose you give, the more improvement you have. But with monkeys, no. You only get certain improvement with certain dose, and when you give higher dose, you don't get any more improvement. Right? So the hypothesis is that we are more like monkey than mice, most of us anyway. So the dose for human might be also very narrow because our neural networks are complex, like monkeys. There's no side effects. For higher dose, it's not going to diminish your base rate, but it doesn't give you any more additional performance outcome. So hence that there is this optimum dosage, right? And not only did it lead to cognitive performance, but also overall mortality increase as well. So that there are a lot of behavioral assessments. So the question is how to translate that to humans, right? Behavioral assessments to do with memory, learning, something called executive function in the brain for those that receive the treatment, and their performance get enhanced even in older animals as well. So we have already mentioned the mechanism, which is the brain plasticity, synaptic plasticity to adapt, to form new connections that lead to better cognitive health in the older monkeys, right? So this is the very similar to cognitive therapy, the improvements. For those who knows about cognitive therapy, is a type of psychotherapy. So this is another paper. The higher dose did not lead to the same effect, right? So that means the dose is pretty narrow. Now, on human studies, what was very interesting is there are certain genes. There are two genes here. The KLVS gene, right? And most of us have what we call the wild type gene, right? The normal gene. About 60% of the population will be homogeneous on the wild one. The KLVS, maybe around 20% of the population will be heterozygous in this. That means that they will have one of this gene and another will be the wild type normal one, right? So of 20% of us with this heterozygous gene of the KLVS and the wild type, if you are so lucky to have this, even if you have the APOE4 gene, which will increase the Alzheimer's risk by, I think, 80% or something, the risk get negated. It's as if you have no APOE4 gene, if you are so lucky to have this KLVS and heterozygous with the wild type gene, right? So that is a remarkable protective effect that is found for monkeys and also for humans. That later they would also show that. And the mechanism would be that when they look at plaque buildup, the amyloid burden for those with this heterozygous KLV gene, the amyloid burden is much reduced. So the mechanism will be the protective effects, right, of reduced inflammation, cellular metabolism, and synaptic function enhancement, right? So this is a human study with 309 participants, those with the KLVS heterozygous gene have a much reduction risk of Alzheimer's compared to those without this genetic variant. Even those that have the APOE4 risk, and their CSF fluid show that they have a much lower level of the amyloid plaque protein. So this is the what I mentioned, right? With those that have this gene, they are able to modulate the ApoE4 risk. And there are other implications as well on cancer, for example, that those with maybe these genes, they show lower or the other way around. Those with advanced stages of cancer will show lower level of Klotho. And also those with Klotho, the assessment, it shows that it has an impact on survival outcome. That means those with lower level of Klotho have a much poorer prognosis for cancer. And there are also implication on suppression of cancer. Colorectal cancer has an inhibitory factor. We have so it works by blocking the cancer pathways, right? These are all the different pathways of cancer, the PIK, AKT pathway, for example. So what we've done is to send this to our partner lab, RGCC, for those with various stages of cancer, and it will give us a report on the percentage of success. And here you can see with one of the patients is 30% compared to other things like Epigenetics, right? So we keep on then using this protocol. There are also studies that found that Klotho level is linked to stress. Mothers of children with autism spectrum disorder have a reduced level of Klotho because of the stress of carrying the special needs child. They also have shorter telomere length as well. As you may know, telomere length is linked to premature aging or your rate of aging, and we can show some measurement for that. All right, it is linked to, so chronic stress and aging can impact your Klotho level, and so would the reverse then be true? So here in our lab, before Klotho, we do a 6-point measurement of the cortisol. The first 3 points of your cortisol, this is called the cortisol awakening test. So the first 3 points, which is immediately after waking up, half an hour after that, and then half an hour after that, we take your saliva sample. Your cortisol should be rising very quickly, right, to give you energy and alertness, but here it is very slow, and then at night, towards the night, you should come down so your melatonin can start working to help you sleep, right? But this is all the other way around, and after Klotho, everything become normalized back towards the middle. Also, your epigenetic clock, right? So before Klotho, this patient have like 1.4. That means every year he's aging 1.4 years. But after Klotho, it's like about 0.88. So he's still aging, but slower, right? The pace of aging. And then the telomere length can be measured as well. Before Klotho, it was around 7 kilobase. After 6 months, it's about 7.5, and you can compare his rate with people of his age, which is around. So when he is at 7, he is like shorter because I think the average rate is around 7.2. So after that, he has a longer telomere length, not only compared. Are we good?
No, they're gonna